My name is Mallory. I am from Maine. I live in Maine. I graduated from college 2 years ago, and now I'm working full-time on 2 grants through Title V. One of them is the Healthy and Ready to Work National Resource Center, and the other is our state D70 grant, which actually just ended. But I'm still working with the State Children with Special Health Needs program through Title V as the youth coordinator. It's hard. It's hard, and it's unfair. The kids that I work with and see on a daily basis should have the same opportunities as their peers, regardless of a diagnosis. Everyone should be able to work. Everyone should be able to go to college. Everyone should be able to have friends. And seeing kids who don't have those opportunities because they can't get services or there aren't people supporting them, it breaks your heart sometimes. It really does. And I want to make that not be the case anymore. You know, there are some times when I get hit over the head with a lot of stories, and I say, no, I'm one person, I can't change this. But I also know that I have the power and the skills and the determination to be the voice of the youth who can't speak up for themselves, and that to me is an honor. The biggest obstacle as a youth advocate is probably getting your voice heard. A lot of groups are striving for youth involvement, but they haven't achieved the point of actually listening and respecting the youth leaders as equal partners. I think a lot of times there's tokenism and thinking that having a youth in the room is enough, but it's not enough. We have a lot of work to do, and I would like to see it get to a point where every state has a youth advisory council, and youth are being invited to national conferences and meetings and are really actively participating and being engaged. I think that all youth have very valuable skills and stories to offer, and I think that people at a higher level and in places of power need to start listening and realizing that we're in the system, we're in the programs, we know where things are lacking and where the struggles are. We live it every day, and I think the people who live it need to work with the people who can fix it. And I think if that were to happen, I mean, it'd be unstoppable. Yeah. We're seeing a lot of system changes with the new administration and also budget cuts, and we're in a time of transition. I do want to be a part of that change, but I think Title V has done a lot of good work, but like I said, we have a lot of work to do. There's a surge of thrill and motivation that comes with just being in our nation's capital with people who are listening to our stories, and families and youth are getting more and more involved, and I think it's really exciting that national organizations are listening to families and youth, and I think it's a stepping stone for our involvement, and I'm really excited to stay involved and see how things progress. We have come a long way in the world of disabilities and special health care needs, but we have so much farther to go. So, as hard as it can be sometimes, you got to keep the motivation, you got to keep the energy, and you got to remember why you do it. My main message, that's important, is that we need to all be in this together. It's a big world, and resources are getting more and more limited, and I think that the people with the power and the resources need to listen to the people who are living it every day. And I think that by partnering instead of working against each other is the only way change is going to happen.